If you are thinking of potty training soon, or you've already started and you're hitting some roadblocks and it's not going the way that you hoped, I would like to introduce an idea that might be different and slightly surprising, but one that we have found works really well. And it's the concept that you want to make sure that your child can poop in the potty before you move through the process of potty training. I want to talk about that today. Hi, my name is Dr. Caitlin Keller, and with Dr. Melissa and myself, we have founded Little Learning Lav, like laboratory. And our goal is to get pediatric pelvic health into the hands of families and providers to help as many families as we can who maybe have kids that are struggling with bowel and bladder dysfunction. And what I want to talk about today is specifically related to potty training. Now, in our clinics and in the resources that we have, Melissa and I have through Little Learning Lav, we have really kind of honed in onto this one system in potty training that we think is different. And we haven't seen it before, but we've seen it work. And that's the concept that your child needs to prove that they can poop on the toilet in a seated position before you move through the process of potty training. Now, why do we believe that needs to happen? Because many potty training methods work out there for many different families, and that's absolutely true. But here's the deal: the luck of the draw, the luck of the roll of the dice. I don't know, whatever that phrase is. You don't want to take that risk with your child if maybe they're going to move through a process and it goes really well, or maybe you start a process and it goes terribly. Now, what is the difference between those two options? Because you don't really know beforehand. The secret is you can know beforehand. You can know if your child has the physical skills, the prerequisites to potty training to be able to successfully go on the toilet. That means that because toileting is a physical skill, we want to make sure that your toddler has the physical prerequisites before you push them through this process of learning to potty train. Because if they don't have the physical skills, they're not going to be successful, or it's very unlikely that they'll be successful. And so we have kind of developed this method of helping you to identify in your child and your toddler, do they have the foundational skills, the prerequisites to potty training from a physical perspective? And if they don't, how do we work on those? And what are those skills? Now, I want to give you a couple of them right now because you can look at them in your child at home and help them to realize, or you can realize, oh, my child needs a lot of work with this before we go through potty training. Or maybe you started and they're struggling, and then you do some of these things and screen them and realize, oh, my child doesn't know how to do these things. I need to go back, take a pause with potty training, and pour into this prerequisite skill so that they can be successful. The biggest thing that you can do with your toddler before you move through potty training and check the box that yes, they have this prerequisite skill is, can they sustain a frog squat position while they play? They can have their hands on a table or the wall for balance if they need to, but we want to see your toddler squatting down, feet flat on the floor, elbows and hands between their knees like a frog, and playing. And that tells us that they've got great hip mobility, they've got good core stability, and that they can breathe in that position. Those are some really big physical skills that need to happen before your child can successfully potty train. I know that the concept is really different. I know that out there's a lot of language and methodology about potty training and, the signs of readiness, and there is value to a lot of that. We're adding this additional layer that there's also a physical prerequisite skill. We're not saying instead of, but we're saying in addition to. Your child needs some physical prerequisites before they can successfully potty train, because toileting in a seated position is a physical skill that is very different than toileting into a diaper, maybe in a standing position. So is this more impactful for children and toddlers that are standing to have bowel movements in their diaper, and you think, oh, if I potty train them, then they'll be fine. Or if they're constipated as a toddler, if you potty train them, they'll be fine. Our thought process is help them get the physical prerequisites first, and then potty training will be hopefully easy, quick, and with long-term success instead of relapses and lots of accidents and challenges in the next couple of years. We would love to help you at Little Learning Lab. We have lots of resources, potty training being one of them. We hope that this will bring some good things into your home to be able to help your child and your family. Hi, my name is Dr. Caitlin Keller, and I am the owner and lead physical therapist at Unconstipated Kids. And here at Unconstipated Kids, our mission is to help kids move through and graduate from the challenges related to toileting struggles. So things like constipation, nighttime bedwetting, belly pain, reflux for infants, any kind of challenges related to the gut and toileting, keeping their underwear clean and dry. I hope that today's video pushes you into the right direction to get a great jump start and to move towards full resolution for your child from the challenges they're experiencing.